Good evening. My name is Bridgette Baker, and I'll be your webinar producer for this evening's event. I am pleased to introduce the National Coalition of 100 Black Women, Inc.'s National First Vice President of Programs, Minnie J. Miller.
Thank you, Producer Baker. Good evening. It is my pleasure and honor to bring greetings on behalf of the National Directorate and all the activist members of the 63 chapters that comprise the National Coalition of 100 Black Women Incorporated. Our health and well-being are important, and our children depend on us, and they must be our priority. I am so excited about the conversation that will take place this evening. Let's talk about childhood cancer, the impact of pediatric leukemia in Black children. Thanks to each of you for joining us this evening as we learn more about this important topic. And now I am pleased to introduce NCBW's National Health Chair, Mia Johnson, who will facilitate the webinar this evening following a short video. Chair Johnson is the National Community Outreach Manager for the Myeloma Link program at the Leukemia and Lymphoma Society. She is responsible for establishing community partnerships to foster health equity for Black patients and caregivers impacted by a blood cancer. Through Myeloma Link, the Leukemia and Lymphoma Society helps Black patients and community members enhance their knowledge about blood cancers, cancer racial disparities, and clinical trials, among many other topics. And I am so happy to share, she is the recently installed chartering president of the Fort Worth Metropolitan Chapter. Now, let's view the video, and then you will hear from Chair Miller Johnson.
I think I was strong until she was diagnosed. It took everything. I had to stop everything to be there for her.
Sometimes she would be upset, but I wouldn't really understand why. Seeing me like that, it broke her heart, so I was like, why am I here? I felt worried.
I think she does worry in the back of her mind about it, but even if it's just like it's just a tummy bug, she says, I need my hospital. The cancer's still in me, she'll say.
I remember saying to my dad, I don't think I can do this anymore. He's like, you know, man up and get up and do it. You got to. And I think I knew at that point I needed some help.
There was a lot of support around her, and she wanted to be like every other child, and now she is.
Good evening. The video we just saw is the perfect introduction to tonight's topic. Let's talk about childhood cancer, the impact of pediatric leukemia in Black children. We will hear from a pediatric oncologist and a patient caregiver, and we'll learn more about how leukemia impacts Black children, as well as the resources available to support those diagnosed with the disease. Now, I'd like to introduce you to our esteemed speakers. Dr. Rayne Rouce, Associate Professor, Department of Pediatrics, Section of Hematology and Oncology at the Baylor College of Medicine. Dr. Rouce is a pediatric cancer doctor and physician scientist at Texas Children's Hospital and Baylor College of Medicine. She was born and raised in Houston, Texas, and enjoys nothing more than giving back to the same community that has given her so much over the years. She takes care of children with difficult to treat cancers and leads clinical trials testing new and less toxic ways to treat cancer. She's passionate about giving back and opening doors, especially for underrepresented populations, and leads community outreach and engagement at Baylor College of Medicine and within the Dan L. Duncan Cancer Center. In these roles, she focuses on ensuring all patients and families have access to the best treatments and creating a pathway for underrepresented students to pursue careers in STEM. She leads programs dedicated to providing research opportunities and mentorship to students locally and on a national level, and she is excited to be here today. We also have Courtney Addison, who's a parent advocate and a mom and a caregiver of a leukemia survivor. Courtney Addison is a mom of two boys, Christian Addison, who is 8 years old, and Caden Addison, who is 6 years old. Now, in April 2020, her life was flipped upside down when her son Caden was diagnosed with a rare form of leukemia. Overcome with emotion by the unexpected news, Courtney decided to channel her feelings of devastation and anger into something productive, and she became involved with the Leukemia and Lymphoma Society. In August 2020, she created a Light the Night team that raised over $12,000. Then in 2021, Caden was chosen to be the local and national honored hero. In 2022, Courtney was honored to be selected to be one of the national Dare to Dream ambassadors. In February 2023, Caden relapsed. So the family's journey yet continues. It is Courtney's mission to share Caden's story, to raise awareness about blood cancers, and to do her part to help advocate or help advance research for better, safer, and more effective cancer treatments. We appreciate you both for being with us here tonight. Our discussion, though, we're going to kick off with Dr. Rouce. So, Dr. Rouce, what exactly is leukemia? Are there different types of leukemia?
That's a really great question. First, I'll say I'm so delighted and honored to be here tonight to talk about such an important topic. So leukemia is a blood cancer, and it's actually the most common cancer in children. A lot of people don't think about cancer happening in children, but when children do get cancer, it typically is leukemia. And what happens is it starts as an early immune system cell that has some sort of mutation and kind of goes awry and then begins to grow out of control in the body.
Okay. What about symptoms and risk factors? Can you tell me some of those symptoms, risk factors of leukemia in children?
That's a really good question. So day in and day out, I take care of kids with leukemia, and most of them have been very healthy until their diagnosis. And one thing that it's often really important for me to share with parents and families is that leukemia lives inside of the bone marrow. That's like our factory inside of all of our bones. Like we've all taken a chicken bone or a turkey bone and you see that spongy stuff inside of there. That's the factory that makes our blood cells. And so because that's where leukemia starts, the symptoms we usually see are symptoms because the leukemia is crowding out the normal healthy blood cells. So we may see anemia, which is because the red blood cells that carry our oxygen are low. Okay, so that may make a child feel more tired than usual or even look a bit pale. We may see bruising or even bleeding that's unusual, not after a fall or after an injury. And that's because the platelets, which are the blood cells that help clot our blood, are low. And then also you can have a really high white blood cell count. That's one of our important immune system cells, or you can have a really low one. And all of those symptoms, they initially may appear subtle, but one thing I remind everyone is that every child with leukemia comes to medical presentation at some point because we're not able to explain those symptoms that initially may seem very subtle by something else. So I always tell people that to reassure them, because they ask, do you think that last year when she had a headache, or 3 months ago when her leg hurt, do you think that was leukemia? And I have to reassure them that most leukemia in children is very acute, meaning it hasn't been there for that long. And so when they come to medical presentation, it's usually because these symptoms are not otherwise explained, if that makes sense.
Makes total sense. Makes total sense. Thank you for explaining that too. As I was going over your bio, it talked a little bit about you making sure that you are, in the community, particularly for an underrepresented community. So can you tell us how leukemia impacts Black children and our community, and why it is so important for our community to know about this disease?
Absolutely. This is so important. I am fortunate because I work here in Houston. I grew up here in Houston, and I've always been passionate about advocacy in the community. And I think all of us who are on this webinar recognize that as Black people, as underrepresented people, as people who have been marginalized, we often have to really advocate for ourselves when it comes to healthcare. And we all may have different levels of what we call health literacy. We all have people in our family who are maybe considered hypochondriacs and know everything about everything. And then we have people who say, oh, I'm not going to worry about that. But one thing that's really important, especially with children, these are the apples of our eye, right? These children are our future. So it's really important to know that there is an intuition that parents and caregivers often have when their child is having recurring illnesses or symptoms that can't quite be explained, and they may go to the doctor, and sometimes they'll get reassurance, which is very appropriate. But one thing that I always tell every parent or caregiver to advocate for is if you know that something isn't right, even if you don't know what that is, you often do have to advocate to your doctor to get labs. One thing that is really common in leukemia is that just getting a simple, complete blood cell count, which all of us have had before, will often reveal that some of your blood cells are low or your white blood cells are really high. And that may be a sign that we need to explore and make sure that you don't have leukemia. Another thing is that just in general, it's not that the presentation of leukemia is different in a child than in necessarily in an adult, or it's not that the presentation in a Black child is necessarily different than an adult, but there are certainly lots of evidence that shows that sometimes our ability to advocate for our children may fall on a bit more of a deaf ear. So I try to spread awareness, one, that kids can get cancer, and two, that when you know something is not right, the worst thing that can happen is you get a lab and it's absolutely perfectly normal and we're happy about that and you move on, but advocate for your child.
That's a really, really good piece of advice, and something that as someone who is on the health committee for NCBW, and of course working with the Leukemia and Lymphoma Society, we tell people all the time, if you know something's off, keep going. Don't stop at that. Don't stop at one response from one doctor or lab or anything. So I appreciate you even
Absolutely
tonight. If a child is diagnosed with leukemia, what's the first thing a parent should do?
So the first thing that I tell everyone to do is this is a whole, journey that you were not expecting to embark upon, and it is completely overwhelming. But when I go in that room, I try to really make sure that the first thing that I say is, overwhelmingly, we do very, very, very well treating and curing childhood leukemia forever, okay? Once we have all of the information about the leukemia, we have evidence-based ways that we know are the best way to put that child into remission and hopefully keep that child in remission forever. So once I have all the information, I let parents know that this is likely very treatable and very curable. And I also let them know that the most likely thing is that your child will grow up and be happy and healthy and get into all the trouble, boyfriends and girlfriends and all that they were supposed to do and drive you crazy. But we have to treat it. It's something that is curable, but it has to be treated, and we have to use the medications and the treatments that are tried and true and studied to have the best outcomes. So you have to have a trusting relationship with your doctor. And I meet people often on the worst day of their life. and they don't know me. I'm not their general pediatrician. And so it's a lot of information, but we kind of walk that road together, and I help them understand this is a partnership. The boss is your child. I work for your child, and the only goal is to get your child cured, and for us to do that together and keep you as sane as possible and keep your life going and your other kids healthy and happy while we're doing that.
Said so much. I have so many questions that have come just from that. And so we're going to try to keep it condensed for the sake of this webinar, but that's great information. Thank you so much. Speaking of treatment, once diagnosed, what is the traditional course of treatment?
The traditional course of treatment for any childhood leukemia is chemotherapy. And chemotherapy comes in several forms. It can be through an IV, it can be oral, it can even be directly into the spinal fluid. Fortunately, leukemia is very what we call chemosensitive. So most leukemia we can treat with chemotherapy alone. Occasionally, we do use radiation, especially if it's bulky in a place or if it comes back. And if it comes back, sometimes we'll consider something called a bone marrow transplant, but that's not the standard upfront treatment.
Got you. What about clinical trials? I know I read that in your bio as well. What about that? Is this something that parents should be discussing with their child's treatment team?
Absolutely. So here's the thing. We're always going to do what is evidence-based to give your child the best possible outcome. And that outcome is what we want, is to beat that leukemia forever. Occasionally, we will have clinical trials that may add one additional medication, for example, that has shown in the laboratory, in early phase trials, sometimes even in adults, that it may improve outcomes. So it's always helpful to ask your doctor, what is the standard of care? What's the treatment? Okay. And then ask, are there additional options that may be on clinical trials? And the 99.9% of the time, that doctor will bring this up early in the discussions to kind of lead you through the discussions and tell you how the options compare.
Great information, Dr. Rouce. Great information. And we do have a couple of questions that we've received from participants that I would like to ask you. So you've already mentioned that leukemia, pediatric leukemia, is curable. What I'd like to know is how frequently does it, once you get a child into remission, how frequently does it come out of remission for a child?
That's a really good question. And it depends on what type of leukemia you have. For acute lymphoblastic leukemia, it is less likely to come out of remission, or what we call relapse. However, in 2023, we have plans B, C, D, E, F, G, because we have come so far with the research that we've done. So even if a child relapses with acute lymphoblastic leukemia, we usually have a number of other options that can get them back into remission. With acute myeloid leukemia or myelogous leukemia, AML, there's a higher chance of relapse. So it's almost 50%, and it depends on the features of your disease. We still are doing well with being able to get kids back into remission. Even when you finish treatment, we're monitoring you, doing surveillance. So you're not finished with us. And that's specifically because we're trying to check for any signs of relapse.
So are there, I guess this is a two-part question. Are there any actions that someone can do or take to lessen the chance of developing leukemia? Or would you say this is some type of genetic predisposition, perhaps?
Yeah, this is a really great question. So fortunately or unfortunately, most cancers that occur in children do not have a specific one causative event. Like, we know that smoking can lead to lung cancer. We know that are very strong genetic predispositions to breast cancer, or even colorectal cancer. For childhood leukemias, this is normally not something that is inherited. It's normally not something that you were born with. It's normally not something that was passed down to you. It is multifactorial. So the starting event is a mutation, but there is some evidence that if you've been exposed to certain chemicals, for example, you may be higher risk. The good news is, and I forgot to mention this in those first moments with the family, I'm letting them know that there's not anything they could have done to prevent it. And it was not caused by something that they did. It wasn't caused by something that happened when they were pregnant or anything like that. There are very specific syndromes that can predispose you to leukemia, but we usually know about those at the time of the diagnosis or can identify those through additional testing.
So glad you said that, because oftentimes when things happen, the first thing that we want to do is put the boxing gloves on.
100%. And we got mothers-in-law, grandmas, aunties talking about things that happen. And overwhelmingly for childhood cancer, there's absolutely nothing that you could do to have prevented it. And when you present to medical attention is when you were supposed to present. So I try to take away a lot of that burden and guilt from families. That is inevitable because it's your baby, right?
Right. We have one more question that's come in. And I think this ties to what we've been discussing in terms of, helping families. What can be done to lessen or close the health disparities and outcome for Black children diagnosed with leukemia, whether that is within the family or whether that is with the provider? Like, what could we do?
I would say two things. So the first, I can't stress enough how important it is to advocate for your child. It's not that Black children are diagnosed with leukemia more. It's that it's possible that they may be diagnosed at a later stage, whether that is because of a lack of health-related resources, whether it's because of non-specific symptoms and not having a trusted provider. The second thing is that once diagnosed with leukemia, because we have to give pretty heavy duty medications that fortunately kids' bodies are strong enough to tolerate, we have to give heavy duty medications that can kill the cancer cells, but also can make you immunocompromised. We have to make sure that our kids are able to get to the doctor, to the emergency room as quickly as possible, that we're able to really protect against some of the known risk factors that can increase your likelihood of having an event like I saw in the opening slide when we talk about AML, acute myeloid leukemia, that Black patients often will have more toxicity related to it. So this is not something like breast cancer or colorectal cancer where you're actively screening for, and it actually is very rare. But if you see something and your gut is telling you something is not right and you're going to a provider where you feel you're not exactly being heard, advocate for yourself. And if you don't have a trusting relationship with your provider, I tell people every day, including my family members, it's time to find another one.
Thank you so much for this valuable information, Dr. Rouce. We certainly appreciate you sharing that. And this is a great segue to hear from our patient caregiver, Courtney. And so, Courtney, thank you for joining us this evening. And in light of what we just spoke about in terms of if you see something, if something just doesn't feel right, if you don't mind, take us back to before your son was diagnosed with leukemia. Did you know or feel something wasn't right, or were you just caught off guard?
Yeah, so when Caden before he was diagnosed, he was your normal healthy kid. He was playful, he was silly, he had a huge appetite. And so it really did kind of catch us off guard. It first presented itself as leg pain. But his older brother had, growing pains or leg pain. So I just kind of was like, oh, okay, it must be fine, because it would come and then go away. But one day I happened to take him to daycare, and his daycare provider said, hey, Caden, he was not walking at all yesterday. He was kind of scooting around the floor. I just wanted to let you know. So immediately I left, and I was like, that's not normal. Like Dr. Rouce said, I trusted my instinct, and I immediately got him an appointment, turned right back around, took him to the pediatrician. They did x-rays, and they were like, oh, everything looks fine. Just kind of everything looks fine. It wasn't anything else. And so that day we were headed to Richmond, Virginia to visit my parents. And he started moaning in the back seat. And when we got there, he had a fever. He wasn't eating. And that was the weirdest thing because he loves his food. So I was like, something isn't right here. And it started to progress even more to the point to where when we would try to pick him up, he would like flinch in pain. He wouldn't turn his head. And he just wasn't acting right. And so I ended up taking him to the emergency room, which I was trying to avoid because this was at the very beginning of COVID. And they tested him for flu, tested him for COVID, and they were like, oh, it's probably just the flu, it's fine. Just give him Tylenol and water. But I knew something wasn't right. And so I called his pediatrician back in our area, in the Tidewater area, and I said, something's not right. So she said, if things don't get better in a couple of days or they get worse, bring him in and we'll talk. And so I brought him in, and she suggested that we get blood work done. And that wasn't a success. So she said, go to the emergency room. We have to get this blood work. And so I'm personally very thankful because I know a lot of other parents that I've talked to, their pediatrician was sometimes dismissive of their concerns. And the ER was a little dismissive of my concerns, but I was very thankful that his pediatrician recognized, and she knew that I know that mommy gut was real, and she really advocated and pushed that we get that blood work. And that's how we ended up finding out.
Okay. Did you know anything about leukemia before your son's diagnosis?
I knew nothing about leukemia. It was a term that I had heard before, but it wasn't something that I was very knowledgeable about at all.
Okay. How did you handle the news? How did you prepare yourself mentally for the treatment process? And then how did you turn around and prepare your baby?
This happened over 3 years ago, and I don't have the best memory, but I will never forget that day. We were waiting at the time, they thought he had a spinal abscess, so they were going to do MRIs and all that stuff. And I remember the doctor came in and he said, we need to come back. We need to bring a couple more people with us. And they walked in the room and they said, Caden has leukemia. And I literally collapsed in my husband's arms. My heart was pounding. My hands were shaking. I didn't hear anything else after I heard that news. Completely shut down. It was by far the worst day of my life. Just never in a million years would have expected that we would be here. So for me, it was so overwhelming and there was so much information. Again, I had no experience with leukemia before. So it was very overwhelming with information because we started right away and we just had to keep the ball rolling. In terms of preparing Caden, that was really hard. He was only 3. So trying to explain to a 3-year-old what's going on and why he can't go home and why they have to stick a needle in him and, all those things, it was very difficult. So we just were there for him. I was there, I laid in the bed with him. I was there with him before he went into surgeries or anything like that. And we were just there and we just told him that the doctors were trying to make him feel better.
Got it. So then what was the treatment process like?
The treatment process was pretty overwhelming only because they started treatment the day that we found out. He immediately went into surgery to get a port put into his chest, which is how they administered his chemo. So he had to go into surgery. So that was terrifying for me as a mother, seeing my 3-year-old son go into surgery. He started chemotherapy right away that same day. And it was so overwhelming because I couldn't even pronounce half the medications. They're giving me these long sheets of these potential side effects and things like that. And it was very scary and very overwhelming as I'm still trying to process the news that I just received. Overall, we spent the first probably 2 to 3 weeks in the hospital while he received chemotherapy. We unfortunately did have lots of hospital calls. Like Dr. Rouce said, we had our go bag packed. And so if he spiked a fever, we ran to the ER. We had to drop everything and take him to the ER. So we did have that. He was on a chemotherapy regimen. Unfortunately, we found out that he had a very rare type of leukemia that only happens in about 3% of cases. So he had to take chemotherapy every day. He had to take an additional medication every single day for the full 2 years that he was undergoing treatment. One of the scariest times happened in March of 2021, where his body, he was very immunocompromised, and he just was not feeling well. And because his immune system was low, he ended up developing sepsis and a fungal lung infection, and it landed him in the hospital for over a month. And that was a very scary time. He was high alert. They were running all kinds of tests, just trying to figure out how to make him better. So treatment during his initial treatment was pretty scary. I will say after he relapsed, obviously very devastating as well, very similar kind of experience, but I did feel a little bit more prepared since I knew the medications, I knew the process, I knew the procedures, and I had an understanding of what to expect. And thankfully, due to my involvement with the Leukemia Lymphoma Society, I knew a lot about some of the advances in research that came about. So he received immunotherapy and then a special type of targeted chemotherapy called CAR-T, where they actually modify his white blood cells to attack the cancer. So this round of treatment has been night and day. He has had like barely any side effects. I think he had maybe 1 day of nausea. He has handled it so well. And actually, this is the first time that he's been in complete remission, no leukemia cells found or traceable or detectable in his body. So I'm very happy with the advances that have happened even within 3 years to get him to this point today.
Good. I have one final question, because that was a lot, right?
Yeah.
One final question: what helped you get through the treatment and get you to the point to where you are now?
Lots of prayer. And I mean that, lots of prayer. My family was incredibly supportive. I honestly, and I think Dr. Rouce mentioned this, deep breathing helped me. It is, you can come for me, you can come for my husband, you can come for all the type of people, but don't come for my babies. Don't mess with my babies. And so it was so hard. And so a lot of times I would literally have to make myself sit there and breathe. Because as Dr. Rouce said, I knew that I was my son's only advocate. I had to keep it together in order to advocate for him. So, really just the breathing, prayer, and then really depending on my family. And I'm one of those people, information makes me feel a little bit more comfortable. So I just did a deep dive into really trying to learn as much as I could. And as you mentioned in my introduction, I really wanted to channel that really hard, terrible emotions into something productive. And so that's why I ended up getting involved with the Leukemia Lymphoma Society. So those were the main ways that I was able to cope.
Well, I really appreciate you sharing all of that, sharing your testimony here for us tonight. I am sure that those who are parents of pediatric leukemia patients, or those who are on tonight who may know someone who is a parent of a pediatric leukemia patient, will be able to relate to the story. Even if someone has never heard of this until tonight, it's great to be able to share the information, because, should they need it in the future, we've planted the seed, right? So I appreciate you and thank you for your time and sharing your journey.
Thank you.
We have talked considerably about pediatric leukemia as well as treatment. And we haven't covered some of the resources that are available for both patients and caregivers through the Leukemia and Lymphoma Society. I'll first share the mission. The mission of the Leukemia and Lymphoma Society is to cure leukemia, lymphoma, Hodgkin's disease, and myeloma, and improve the quality of life of patients and their families. We fund research to advance life-saving treatments. We drive advocacy for policies that protect patient access to life-saving treatment. We provide patients and families with hope, guidance, education, and support. LLS is committed to providing information, resources, and support to those affected by blood cancers. Here are some of the ways that is provided. There's the Information Resource Center. Patients and caregivers can get support from our information specialists, highly trained oncology social workers and nurses. They can assist you through cancer treatment and financial and social challenges and give accurate, up-to-date disease, treatment, and support information. So the LLS's Information Resource Centers can help you deal with the challenges of the diagnosis, help you map the best route for diagnosis through treatment and survivorship, provide information, resources, and support to caregivers, help communicate with members of your healthcare team, and provide you with free educational materials to help you and your child on their cancer journey. Here are ways to get in touch with LLS. To contact an information specialist about disease, treatment, and support information and resources, call 1-800-955-4572. They are open and available Monday through Friday from 9 a.m. to 9 p.m. Eastern Time, or you can visit lls.org. Another way that LLS provides support is through the Clinical Trial Support Center. So LLS provides a free service to take on the burden from, parents and families. They do that by working with, allowing you to work one-on-one with an LLS clinical trials nurse navigator who will personally assist you throughout the entire clinical trial process. There's also patient financial assistance support. LLS offers a wide array of financial assistance programs to help individuals with blood cancers. And so again, for information like that, specifically for financial assistance, you want to contact the LLS Information Resource Center, that phone number that I just mentioned to you. No worries, we'll go ahead and provide that again at the end of this particular webinar. We also have caregiver support, where we provide assistance to caregivers, whether it is through online support groups, financial assistance, worksheets or workbooks, podcasts, and of course, the support from the Information Resource Center and the Clinical Trial Support Center. For parents and caregivers of children and adolescents with a blood cancer, we have the Caring for Kids and Adolescents with Blood Cancer, a workbook written for the parent and guardian of a minor child up to the age of 18. And it includes information about caring for your child, treatment options, school, nutrition, financial and legal issues, and much more. This family workbook includes a set of worksheets and activities, and it includes a tote, a journal, pen, and a pill organizer. And so caregivers may order a copy of this full workbook by again calling 1-800-955-4572. LLS also offers webcasts and videos and interactive telephone and web education programs with experts covering a variety of blood cancer topics. And so for more information on that, you would just visit lls.org/programs. There's also our podcast. It's called The Bloodline with LLS, and it's here to remind you that after a diagnosis comes hope. So with this podcast, you get to listen in as experts and patients give listeners an understanding diagnosis, treatment, resources available to the blood cancer patient. And so for information for that, you would want to visit lls.org/the bloodline. There is the peer-to-peer support. That is the Patty Robinson Kaufman First Connection program. And this program introduces patients and their loved ones to a trained volunteer who's gone through a similar experience. And so I don't want to call it a mentorship program, but it allows you to speak to someone who's walked the road, who understands what's going on, who may even understand some of the feelings associated with being a patient or a caregiver. And so it gives you an extra layer of support. And so for more information for that, you want to call or log on to lls.org/first connection. And then we also have the LLS community, which is an online gathering place for patients and caregivers and healthcare providers to share experiences and provide support. And so LLS provides that information and resources to support patients and caregivers from diagnosis and throughout the cancer journey. So for personalized disease treatment or support information, or even some of the questions that I see you all are dropping in the chat, for some of those very specific questions, I want to encourage you to contact LLS. Call 1-800-955-4572. Again, that's 1-800-955-4572. Open Monday through Friday, 9 a.m. to 9 p.m. Eastern Standard Time. You can also visit lls.org. And if you go online, there's an option to chat. There's an option to email. So even if you reach out outside of those hours, someone is able to get back to you. At this moment, I am going to turn it back over to our National First Vice President of Programs, VP Minnie Miller, for some acknowledgements and closing remarks.
Thank you so much, Chair Johnson. What an amazing presentation this was. I've learned so much about blood cancer, and I am sure that all of our participants, as well as our members and our special guests, have done so as well. A special thanks to Dr. Rouce, our parent and caregiver, Ms. Addison, for sharing that very, very important information. We also would like to say thank you to our members, our guests, our producer, Bridget Baker, our corporate office staff, Alfreda Stutz, for making this presentation possible. And so we can't say enough about the Health Committee under the leadership of Chair Johnson for an outstanding presentation. We are so thankful and appreciative of the partnership with LSS, and we look forward to continuing this relationship. And I am certain that you will be able to go back to your community as well as back to your family and friends and share this very, very important information. So now I'm going to turn it back over to Chair Johnson for our final closing remarks. Again, I am so grateful and so thankful for being able to hear such an amazing conversation. Thank you.
Thank you so much, VP Miller. I appreciate that. And I'd like to also say, on behalf of the Leukemia and Lymphoma Society, we want to thank you all for joining us here tonight. We want to also thank our lovely guests, Dr. Rouce and Courtney Addison, for being here. And we wish you a wonderful rest of your evening. Good night, ladies.